agency reported on a contract that they had with the AARP to do a cost-benefit analysis of different drugs that seniors use. Well, guess what? They couldn't. And the reason is that the studies that were presented as being scientific were in fact promotional. And they could not, as a result, make these kinds of cost-benefit analyses, even though so many programs are being bankrupted by the Me Too molecules and the promotion by the different pharmaceutical companies. This has caused me to become quite skeptical with regard to the legitimacy and the veracity of the so-called scientific articles. So when people are talking about the gold standard of the double-blind, it's almost a joke because of the fact that so much of the material that's published.
Is that not the gold standard anymore?
Well, they would like you to think it is. But in fact, the gold standard is veracity, whether or not what they present to you is in fact truth, or if it's just a rationalization for buying their particular product.
Is there, if I was a physician and I was completely on the other end of the spectrum as you are, and I asked you, what is the best study that you have ever seen for research? What is the best one? What is the one that you feel, if indeed you do feel, that this one is beyond reproach?
There is no one, but any study that took place before the 1937 Marijuana Tax Act, and 2 years later, 3 years later, when it was taken off the market, anything that had to do with clinical descriptions prior to the advent of the takeover of the criminal justice system. I don't think that the physician of today appreciates how information has been systematically degraded, starting with the language that has been substituted by the criminal justice community. And it's really embarrassing. It's an argot that might come out of the Middle Ages, that you wouldn't know it was the same drug. And the credibility of their statements is lacking. And so when people talk about double-blinded this or that, we need to talk about dishonest this or that. We need to talk about realistic scientific descriptions. If you looked at the description under the Controlled Substances Act of 1970, that's a piece of shit. Totally dishonest, totally incorrect, as compared with the description of the pharmaceuticals before 1940. So the definition of cannabis for the U.S. Pharmacopoeia, which is realistic, and prior to the being taken off the market, that's the definition I would run with. The phony definitions that are total exercises in dissimulation that have taken place since have systematically degraded the quality of medicine. It's very much like a scene out of the Planet of the Apes. And I've come back from the cave where antiquities were stored under layers of rubble and a lot of shit. And so what happens when I come back bearing these insights? So once upon a time you used to know about this. The answer is shut up. We don't want to hear you. And then putting in all sorts of pejorative terms, and then accuse me of being an activist and giving me the old discount of what do you think of a person that says something like this. But if you want a credible study, if you want something you can rely on, go back to the pre-prohibition driven menu of effects and descriptions. So, you know, people can cry double blind. They don't know what the heck they're talking about. They're using this just to rationalize why they're not willing to explore more. That is just a cover-up to their rationalizing why they have poor ears and can't listen to their patients. This is what I find amazing. I started out my clinical studies by enumerating the mentions in the pre-prohibition literature and starting my questionnaire out from that. And what has happened is that I've run into almost 200 kinds of conditions in contemporary diagnostic terms where people have described cannabis as being useful. So what are you going to do? Discount all of what they say and say, I don't believe what you're saying? Well, this is what, unfortunately, the brainwashed, ignorant physician of today will say, because where are they going to find out this kind of information? They rely on the people that are telling them untruths. They're relying on the DEA. I mean, listen to what the DEA has to say about it, and this will tell you what the reigning argot and vocabulary is. And this is bad. This is wrong, this is immoral, and this is hurtful to many patients who have made these insights.
As a documentarian, part of my responsibility is to try and find whatever the latest scientific, and I'll put that in quotes for the moment, research is on the medical advocacy of marijuana. Is there any place that you could point me to say, look at this study, whether you think it was good or bad or pro-pot or you know?
No.
Okay, so
and it's because of the devolution of the science, of the so-called models that are put out there that are very much like trying to recreate the Venus de Milo with Lego blocks. The concepts are just totally inadequate and done in a vacuum without any kind of clinical substantiation. They can make all the statements they want about their philosophies of how things work based upon incorrect premises, and it'll still be just as illegitimate as the premises are.
Is there a particular ailment, disease, that comes to the top of the list of all the things that marijuana could potentially help with? Is there something that's at the top of the list? Is it the effects of chemotherapy that the greatest number of doctors would go, you know, for this in particular, okay, it really helps the most with this? Does something come to the top of that list?
Yeah, pain.
Pain. As opposed to nausea, or are you in
No, you see, when you start making these very narrow casting questions, there really isn't any way to respond to them because of their narrow nature. And you have to understand that cannabis has multi-system effects that are unique. If I were going to categorize cannabis, I would call it an easement as a proper classification, because it's not a narcotic, it's not a sedative in the usual sense, but has all these unique effects that encourage normal physiology. I would categorize it as both an easement and a homeostatogenic material. And I don't know any other medicine that you could apply this characterization to. The other way it's unique is that it's not an aqueous soluble drug, that it works in totally different ways within the body with regard